All right, Wyatt. Good to see you.
Good to see you too.
Yeah, I'm glad you're here. We went over this before. I showed you exactly where that alignment problem is in your back, in your lower back, and I showed you exactly how that bone is subluxated. And that term, subluxation, means out of alignment. And so now I need to connect the dots for you on why you're feeling like you're feeling.
Okay.
Now, what you're feeling with that pain that wraps around the front and kind of comes into your groin, okay? And also, you guys, there are so many symptoms that all present in a different way that all lead to a disc herniation or a disc bulge. And so somebody may describe numbness or tingling in their upper butt. They might describe a knot in their buttock. You might find that that's where things are most painful. You might find that they're, bent forward or off to the side. The classic presentation of a disc problem, and all those different things. So it might be numbness on the back of the leg. It might be numbness that goes all the way down. It might be just a numb foot. It might be just the bottom of the foot. So make the connection, though, between what you're feeling and what you're presenting, Wyatt, with what's going on here with what I'm now going to show you, okay? So that's subluxation. I'm going to have you just back up a little bit, Wyatt. That subluxation leads to what's called a bulging disc or a herniated disc, okay? And you can see the disc is like this piece of cartilage. It's like a cushion between the vertebrae. And there can be a small little bulge or there can be a big bulge. And this is where the nerve comes out, and this hole right here is called the intervertebral foramen, which in Latin means little hole between the vertebrae. Okay, and so when the disc bulges into that space, that's where the nerve is at, and that's where the nerve gets pinched. Okay, so now I want you to come this way a little bit. So ultimately, the questions you're going to have are going to be, well, how did this happen? Why did this happen? And what do we need to do to fix this? Okay, so I have a wonderful little poster, and Wyatt, back in the old days, I used to actually draw this, okay? And eventually I had somebody actually draw this really nice for me so that you could better understand exactly what happened to lead to this issue and why you're here, and then what your options are in order to take care of the problem, okay? So I told you about the subluxation, and that's the alignment problem that we found on your x-rays. And we also found it when I was pushing on your lower back, okay? So everything starts with that small alignment problem that then weakens the ligaments, okay? There's ligaments that hold the disc in place, and they need to be strong. But what's interesting is that if you and I want you to hold the other side of this. If this was a towel, okay, and we were holding this, and then I moved like this, so I'm a vertebra, you're a vertebra, we're holding a towel between us. If I shift like this, then all of a sudden this towel kind of goes limp. That's what happens to the ligament when the vertebrae subluxates. The ligament that holds the disc in place gets limp, and it allows for trouble to happen because now that ligament is not taut, it's limp, and it's going to allow for the disc to bulge. And it's kind of like an ice cream sandwich, like an ice cream cookie sandwich. Okay. So when you squeeze an ice cream sandwich on one side, the ice cream pushes out on the other side. And normally those ligaments go from here to here and hold the ice cream in place. But when it's subluxated, that ligament weakens and it allows that disc to bulge or push out through the ligament into that space, okay, which I showed you over there, where the nerve is at.
Okay.
So that little nerve is coming out now, and it's got something pushed up against it. That bulge is pushed up against it, and it's like stepping on a hose, okay? The hose here represents the nerve, and we've got a pinched nerve here, where now there's pressure being put on the nerve, okay? Now, everybody and their uncle knows what a pinched nerve is, but very few people know how to fix this. Now, once you've got a pinched nerve, all the fun starts to happen, okay? You get inflammation, okay? And you also get muscle spasms, okay? Because your body wants to take care of the problem. So your body sends more blood to the area to where this nerve is pinched, and the blood is going to the area to try and heal it because it's irritating. And then the muscles around it are spasming, they're getting tight, they're splinting you. Okay, that's why the other day you told me that you were kind of bent off to the side. In fact, you're still that way today. But when you were kind of bent off to the side, that's the muscles splinting to try and protect you to keep this from getting worse. So now you got muscle spasms and inflammation, and what do those give you? Pain. Now you walk into your medical doctor or some clinic in town, and the medical side, and thank goodness we have medical doctors, but the medical side, they are going to deal with this. Okay? Their options are to give you a muscle relaxant, an anti-inflammatory, and a painkiller, any one of the three or all three. Oftentimes you'll get all three. Okay? But unfortunately that only deals with the stuff that's over here. The other option is to actually go here, and where the disc is bulging, they go snip, snip, snip. They can actually do surgery to snip off this piece of bulging disc. It's called a discectomy. And then they can throw that in the trash, and that may or may not fix the issue temporarily. But what's not happening is you're not dealing with this problem or this problem. And so unfortunately, even if you go to the extent of snipping this out and having surgery, it doesn't fix this, and more disc material eventually fills in the same spot, which is why a lot of people that have had discectomies will have multiple discectomies, not just one, because they haven't fixed it. So ultimately what we have to do, if we want to deal with this, we have to deal with this. We have to deal with the subluxation here. That's what we do. That's what we're good at, okay, is correcting subluxation. So ultimately, this is where we need to spend our time. If we can correct this, then the rest of this is dealt with. Meanwhile, while we're fixing this, I may be suggesting to you a few things. I may be having you ice your back. I'm probably going to have you, maybe even using a product like Stop Pain. You might be seeing our massage therapist to work with these muscles that are freaking out. Okay, so some of the things that we can offer here, some services, are to deal with these things temporarily while we're fixing it. But the only fix to this is to deal with it right here. Does that make sense to you?
Yes.
Okay, so this is very clear with what we saw in the x-ray. It's very clear with how you walked in here, what we found on our exam. This is exactly what's going on for you. Just so you know, you're a special guy, you're a really nice guy, but this is dime a dozen. We see this all day long. We'll probably see 30 people today with the same issue that you're dealing with, and we know exactly what we're doing to fix it. Okay? Now, the challenge is it's not fast. Okay, we can't just take a bone, move it from position A to position B. It takes time. It's a little bit like straightening teeth. If we want to correct somebody's gap in their teeth, we can put braces on, but it's going to take months, if not years, to fix that. You're not going to be years. This is going to be months to get this right. So it's going to require you and I to become good friends. But we're going to get it done.
Awesome.
Okay? All right, so this is my explanation of that disc bulge, how it happens, why it just happens when you're bending over to pick up a pencil off the floor. It's so common to not be something significant. Where this occurs. It's just something as simple as somebody putting their socks on and that disc just slips. That's why they call it a slip disc. The disc just bulges out, and then it just creates all these symptoms. And it seems like you should have to lift the back of a Volkswagen to make this happen, but that's not true. If there's a subluxation, then the weakening of the ligaments makes this so easy to happen. Okay? So that's my explanation of this. It's super easy. You can have something like this made. You can do a drawing, a stick figure drawing, like I did for probably 3 or 4 years before I had that made. It's super easy to explain and makes your job a lot easier when you're trying to explain the significance of that.